Okay, everyone. We are starting today with our work session on the transit proposed budget and fare strategies. David Eatman. And I would just like to add that Councilmember Branch is absent and excused today. His daughter Carly's godmother was the person in Gardner who was killed in the custody issue. So let's say a prayer for him today. He's going through a lot with that. And send him some thoughts. Thank you. I can't believe that.
All right. Well, good morning, Mayor and members of council. David Eatman, Transportation. And today we are here to talk about the Transit FY25 operating budget and to review some fare strategies. Today, that is not me, but today we do have two presentations here. We'll open up with talking about the budget, and then we're going to go into our fare strategy discussion. We do have a lot of content, certainly want questions, but just letting you know we will have a break in the middle between those two distinct presentations. So the agenda today, talking about Transit's, our system characteristics, key accomplishments, our 25 base budget, our 25 Wake Transit budget, and certainly our fare policy considerations, and that will be the second presentation. So just hitting some of the highlights here. We did get a new contractor last year, RATP Dev. They've been operating our fixed route buses since April. We have 34 fixed routes, 4 contracted routes, 116 buses in the fleet currently. And we transported a little over 4.5 million passengers in 23, and that's still down from pre-COVID, but we are recovering. So RATP Dev also operates our Go Raleigh Access or ADA system, and we do have 20 of our own vehicles that they operate. That does represent less than 10% of our trips. We do have up to 42 taxi operators. That does fluctuate. They represent approximately 177 vehicles, and they do over 90% of all of our trips, and that's about 1,200 trips per weekday. And they did just over 800,000 trips last year. Real quick, talking about RATP Dev, on the Go Raleigh Access side, that is the Teamsters Union, so they do have their labor force. They do collective bargaining with the Teamsters. And then on the fixed route side, they have Amalgamated Transit Union, the ATU side, and they represent our collective bargaining agreements with the ATU union for their fixed route system. So some of our key accomplishments in 23, over 70% of our fleet is now zero or near zero emissions. That represents mostly CNG, but some electric vehicles, and that will grow in the next 2 years. We did have 28 full shelter build-outs with 15 bus stop improvements, and that did include 6 enhanced bus stops, which in the future will have lighting and real-time passenger information as well. We did award design recently. You probably remember this. This was early in the year for 250 new shelter sites, as well as we began construction or awarded that construction recently for 49 additional sites. They'll actually be under construction very soon, if not already under construction. Our key accomplishments continued. The Southern Corridor was funded by FTA with CIG, or Capital Investment Grant Program, right at $86 million. We did host the groundbreaking at the end of 23, and we did advertise that project March 5th. So very excited to get that on the street and opening up bids in April. We did complete a 230-space park and ride at Busway, our operations and maintenance facility. We're thinking ahead. We do have 12 EV chargers currently at that park and ride, as well as the infrastructure there to add an additional 12 as those needs grow and we continue to electrify personal vehicles as well as our own fleet, quite honestly. Our base budgets. So transit does have, I'm not going to go into a lot of detail on this, but we have 5 budgets that we develop annually. Our transit budget is what we call it. That's our fixed route transit budget. Our paratransit budget, which we just talked about, which is our access system. We also have a planning budget, which includes federal funds from multiple sources, as well as local match. We'll have our travel demand management budget, which is 50% federally funded as well, with a 50% local match. And then we have the Wake County Transit Plan budgets, which include capital and operating as well. Our Go Raleigh fixed route finances for FY24, our budgeted revenues and budgeted expenses. One thing to point out there is our service contract is by far the largest expense, and then our revenues really come from federal general fund and the Wake Transit Plan and state funds. State funds represent about $3 million of our operating budget. The rest of that is Wake Transit Plan, so about $20 million overall generally within that. Again, total budget of $56.9 million. Our fare box revenue pre-COVID FY19 was at $3 million at that point. As we think about our paratransit system, also a very large program, federal and general fund and Wake Transit comprise our revenues on that side, along with, again, our service contract being the lion's share of our expenses for that. So again, that is under both scenarios, that service contract is what we pay our contractor, RATP Dev, to hire, employ, retain drivers, and to operate the vehicles. So relief funding, we did receive COVID funds in several different source types during the pandemic itself. And so we did use those throughout the pandemic to fund our fixed route operations, our paratransit operation. We have used the relief funding to support each fiscal year since 21, but they will be depleted this fiscal year. So we are expecting those to be completely utilized by the end of this fiscal year. So a combination of cost and some other things that we'll talk about in a moment. We are looking at a 25 general fund budget deficit of $8.2 million. We did talk about that last year at this time. It was actually the same month of last year in 23. We did see this coming. We knew that with the sunset of those federal funds and with that pent-up really a number of factors, I can't just blame it on inflation, but there's a number of factors there that we would be looking at a deficit. So lots of information here, but the key point is if you look in the far right-hand column, unfortunately, under FY25 budgeted, you're going to see an empty box. And that empty box is where our COVID funding was filling that hole through the COVID pandemic. So when you look at that deficit with some of the increases, you can see their utilization of COVID funds went up and down. They were higher in 23 than they were that we were projecting this year. But again, that line item overall is slightly up in projected for FY25. Our paratransit costs, some good news on top of all of that is that with the implementation of really a number of things, just software, and really just our oversight of understanding the system better in a COVID environment, those costs have stabilized. I mean, they're really where they were pre-pandemic. So we're carrying individuals just like we did in pre-pandemic, but we're not seeing that growth like we saw when we went fare-free. We got to realize that over 90% of our system is a taxi-based, door-to-door, curb-to-curb system. And when you provide that service at no cost, it will drive trips. It certainly will drive trips. We know that as a fact. Obviously, there's a lot of other things that could contribute, but we do know that certainly if things do not have a cost, then you're probably more likely to utilize them, especially if it's a premium service. And we do think that our paratransit service, especially on our taxi side, is one of the best in the nation, and we are actually a destination for persons with disabilities for utilization of that system. So what are the base budget influencers? I've talked about many of these already. New Go Raleigh fixed route contract structure, in 23, collective bargaining agreement. We do have fairly new CBAs for 3 years under each of those contracts. So we do have stable labor agreements between our contractor and those labor unions. We have the new Go Raleigh Access Paratransit software we just talked about. We have passenger and driver security, which is there. And we also did calculate returning to fares within that base budget. So as you looked at that budget, as we talk more, the fares that we project in year one are included in that number. So our supplemental for FY25, $8.2 million. Again, that is needed to cover our operating for FY25. Don't want to be redundant, but again, these are the reasons contributing to the need. We did see a small or a reduction in general fund at the beginning of the COVID pandemic, and certainly putting that back in along with the inflationary cost over the pandemic. So really you're looking at about a 3 to 4 year period, and transit was experiencing about 8% annual inflation. So you think about 8% over a 3 year period, you're almost at 25% growth just with inflation. The labor market and our commodities markets were really expensive during the COVID. That has settled, but still we're going to feel those effects well into the future. Again, I mentioned the new contract structure, federal relief funding being depleted this fiscal year. But you have to also think that this investment in transit will keep our baseline obligation for service hours and dollars as part of the Wake Transit Plan and as a partner to that plan. So that plan states that it really funds everything new. So all new service hours, we'll talk about this more in detail in a moment, but it funds all new service hours and the inflationary cost associated with those new services, and they are pretty much funding all of our capital except for some small items currently. But the supplemental does again include fare projections into FY 2025. So briefly going through Wake Transit Plan investments, this is really a bullet list of what it's done to date. So currently, just in our recurring budget, they have $13.4 million invested within our services. That's about 35% of all of our fixed route services. That's 17 routes that either they've funded wholly or partially. Our bus replacements, I'm very proud to say that we probably have one of the best replacement schedules in the nation as far as bus replacement. FTA looks at a bus age at 12 years. We're able to replace one at 12 years, and our average age of our buses is 6 years. So we're right in the median. You don't want to be too new because that means all of your buses age out at the same time, and you don't want to be too old because obviously you have an old fleet. So we're right in that sweet spot. We are projected to have 250 operators and about 55 maintenance technicians by FY30. So again, this plan will continue to grow. Our operating for FY25, these are all new funding items. We do have a number of routes, Route 11 Avent Ferry, 12 Method Road, Glasscock, Carolina Pines. And then we do, through the Wake Transit Plan, provide an express service to Rollsville. And the Wake Transit Plan, as well as Go Raleigh, we're turning that into a micro transit service. Their passengers per hour, we're at a micro transit level, so it will be supplemented with a more door-to-door or point-to-point service such as microtransit. And again, all of these services are 100% funded by Wake Transit. So going into our capital project budget for Wake Transit, FY25 is a large year. Most of these projects, except for our paratransit vehicles and fixed route vehicles, are existing projects. These are just additional funds for those projects. But again, a large investment in our fleet replacement. Midtown Transit Center already has some funds allocated. This is again for land acquisition, for a future transit hub in or around the Midtown area. Enhanced transfer points and bus shelters at $3.2 million. The Wake Transit Plan, as well as the Transit Division, view the passenger amenities as an ongoing priority. I think that everyone has historically agreed with that. We have our paratransit maintenance and operations facility at a little over $21 million. This is the second installment on that, plus we have a $10 million build grant for that facility, and we are projecting that facility to use all available funding, which will be around $50 million, and we do have a site secured for that investment currently. Our Southern Corridor BRT, this is our final installment on the federal funds to reach our 50% match. We'll have Western Corridor funding, which will finish up preliminary design and potentially take us into some final design. That should. And certainly our Northern Corridor, this will finish up our planning study and get us into preliminary design once a locally preferred alternative is determined for our termini at Midtown as well as Triangle Town Center. So what does it look like from an operating standpoint as we think about Wake Transit and investments as we reach 2030? Currently, 35% Wake Transit and 63% City of Raleigh, and we have some contracted services that represent that 2%. That really flips as we get to 2030. Wake Transit will be funding up to 60% of all services within the City of Raleigh, and the City of Raleigh right at 40%. And the contracted services right now are not predicted to shrink. They're just as a percentage of overall drop to about 1%. So this time, I'll certainly take any comments or questions on our proposed FY25 budget and any of the capital items that we discussed.
Any questions? I'm sure there are. Councilmember Patton, then Councilmember Jones.
Yeah, hi, thanks for being here. On the topic of paratransit, when are the taxi cab rate changes coming back to us? I had thought they would be back this week, but they aren't. So do you know when they're coming? And then as a follow-up question, how will rate changes for the taxi cab drivers impact the cost of paratransit services?
So it is my understanding that will come back in April. I don't have an exact date, but that is my understanding that it would come back in April at some point. And as far as that impact, we are assessing that currently. I mean, certainly the taxi rate increase will have a direct impact on our services because each trip we provide will be more. But certainly everything else that we've done has had cost increases, so we anticipate that there will be some increase within the taxi realm for cost per trip increases. But again, we continue to look at that based on the proposed rate schedule. We have a general idea currently, but we should have more information, I would say, in the next week or so. And I would hate to put a number out there and I'd be completely wrong and have to retract it, but we know it will be more, obviously, and we just want to make sure we understand that as we finalize our budgets for FY25.
Councilmember Jones.
Thank you so much. I wanted to clarify, you said that, maybe I misunderstood, that these numbers are based on bringing fares back. So even bringing fares back, we're still 8.2 million in the deficit?
That is correct.
So maybe I just got lost in that, but how are we going to cover that?
The 8.2, that would be the request would be an general fund. Generally, transit's allocations have come from general fund.
Okay, so that would be a request of an additional 8.2 million to cover that deficit.
That is correct.
Okay, cool. Thank you.
Any other questions? Okay.
All right. Well, moving right into our fare strategy and the outline, we'll do a bit of background on our fares, our pre-COVID fare structure, our low-income fare program proposal, some issues and considerations to think about as we review all that information. A quick little peer review, too, so you can see where we stand with other agencies, our transit agencies locally and nationally. And certainly if we do anything, communications is important, and then ending up with what are the options. So as we think about Go Raleigh and fares, who are our riders? So 60% identify as Black or African American, white at 22%, and our Hispanic Latino populations do continue to rise every time we do a survey. This particular survey was completed at the end or the fall of 23, so it is very new data. We did host, or we were the project leads on our overall Triangle Regional Transit Survey. So we surveyed every transit system in the Triangle and got a lot of data. We use that O&D, or origin and destination data, to fuel everything from our stops model for BRT to CAMPO's, or the Capital Area MPO's Triangle Regional Model, which determines air conformity or air quality conformity. So very important survey. We do this one every 5 years. We do some other attitudinal surveys annually. Most riders are employed or are students, as you can see from the numbers here. Important things from this slide, 30% of all riders earn less than $25,000, and 56% live in a household with no vehicle. And those that do have a vehicle available still rarely or majority do not have access to that available vehicle. That does translate if you look at the blue, green, purple, orange, and red, that represents 65%. So 50,000 and below income does represent right at 65% of our total ridership. Moving on to our origin and destination survey data, we were just curious in this COVID environment. A lot of things have changed. How many rode the bus prior to when fares were taken away for COVID? And then with that answer, will you continue to ride the bus if there's no longer a fare? Yes is 91%, and I would assume that that's probably not because they're happy about it, but obviously we do, from those figures that you saw earlier, we do have a ridership that depends upon transit very heavily. Pre-COVID fare structure. So why were the fares suspended in the first place during COVID? So safety was number one. Everyone was scrambling, trying to figure out the best way to continue operations in that environment. So all local transit agencies and really pretty much nationally suspended fares for a period of time, some shorter and some longer, certainly. But we did begin rear door boarding and departures. We had fare collection at the front door, so we closed the front door where our drivers were and everyone entered and exited the bus from the rear doors. And we also installed driver barriers for our operators to keep them safe. But we were able to emerge from that very difficult time. So our Go Raleigh fares pre-COVID, our base fare is $1.25, and whenever you set your base fare, all your subsequent fares, whether that's a weekly pass or a monthly pass, build from that base fare. So pre-COVID, we were at $1.25, and then we had reduced fare, and reduced fare really comes in two forms. That's for a person with disabilities, and that's a fairly simple application process, and we use a variety of sources to verify that. And then there's the Medicare card, which is a federal requirement. Anyone carrying a Medicare card receives half fare. So what did it look like pre-COVID? 30% of our total annual ridership rode free. That included seniors 65 and older, children 12 and under, teens 13 to 18, which was a sponsored program by Wake Transit where they actually paid us for those fares, but the youth rode free. And we did have employer and university Go Pass programs that paid for those rides as well. Pre-COVID. So 12% of our total annual ridership rode at 50% discount, and then 32% rode for free pre-COVID. Our Go Pass contracts, these are just some of the examples along with those who sponsored those programs for their employees or students. We had Youth Go Pass, which was sponsored by Wake Transit, state government, NC State University, Wake Technical Community College, and we also had various downtown and Beltline employers that did provide Go Passes to their employees. So what are options? As we go into this slide, we're foreshadowing a bit. So when we start thinking about the fare-free program and some of the other options that are out there, it might be good to think, how do I frame this information as I'm seeing this? So you're going to see this slide twice. You're going to see it now, and you're going to see it at the end. But again, it allows you to frame the information that you're about to see. So we could certainly, as we move forward, remain fare-free. We could implement pre-COVID fare structure with mobile ticketing or fare capping. That program is ready. We can do that at will at any time. And so that fare capping guarantees a weekly or monthly max payment. So if you buy a day pass every day and you reach that weekly pass rate, then you get the rest of that week free. Or once you pay that daily rate, you reach a monthly pass, then you get the rest of the month free. So everyone pays the same regardless of how they pay for the monthly or weekly pass. Another option out there is the income-based fare-free program we're about to look at. And one other thing that's out there is with all the technologies or some of the technologies I'm about to talk about, our historical fare recovery is eroding over time. Our budget's getting much larger, and it's a very much smaller percentage. And many of those technologies, unlike prior technology, which we would pay once for a technology, we would maintain it and maybe have a software license, but there really wasn't a per-user fee. New technologies are coming out today, just like your Visa or debit card, have a per-user fee, whether you pay that or whether the vendor that you buy something from pays that. So we will talk about that as well. So the low-income fare program, I would have to start by saying this is a work in progress. We are working closely with Go Triangle as they're working on this program as well. But we are working with the continuum of care providers within Wake County. These are just a few of them. Everyone from Oak City Cares to Healing Transitions, Haven House and South Wilmington Street Men's Shelter. And they have been very interested in helping us and actually distributing passes, making sure that we keep a database, a common database of who's eligible. And so they're very interested in working with us and making sure that individuals that qualify for services under their care are eligible for a low-income fare program or pass. We see that Go Pass as probably being an annual pass. So someone receive an annual Go Pass and they would be able to ride free for a year. All right, I did not mention earlier, I do have allergies. It's that time of the year, so my apologies. And if no one knows, it's a really bad allergy year.
Yes,
So,
the pollen in my window is like-
so staff is continuing to work with Wake Transit Plan and TPAC and Go Triangle to fully develop the program, which could, I will say could, include fare reimbursement. So we are looking at ways to receive reimbursement for those free fares that we allow. Every ride has a value. It's just how do you capture that? Sometimes you may capture that from who rides, and sometimes you may capture that from someone who's sponsoring that rider. And that's one of the inherent importance of having a fare. It's not really about who pays, it's about capturing the value of the ride. And so that can happen many different ways. At this time, we're looking at the Access program certainly as a part of that program as well. So certainly any Access riders that were to qualify under the scenarios of continuum of care providers would also receive free rides. Yes, I'm sorry, Mayor. Okay.
Regarding the low fare program, and I might have missed it if you said it, but how long are you thinking like the rollout will take? Or something
The rollout, we would do our best to have a base program available when we return to fares. That would be July 1 if council chose to go that path. It would evolve, I think, over time. It may grow more mature over the year as we learn and understand how that program will be utilized and how we can best distribute passes and aid those that need that, that free Go Pass. But again, that would be the goal.
Okay, thank you.
So existing low-income and agency options. So a lot of things we're doing a lot of things currently on top of the fare free that we're already doing. We talked about many of these already, the fare capping, our mobile ticketing, which allows that fare capping and convenience with a smartphone, which our riders use smartphones, quite honestly, at a very, very high rate. I do not have that percentage. I should have put it in the presentation, but we're surprised. Agency pass discounts for bulk purchases. We do allow agencies, or did pre-pandemic, to allow agencies to buy those for their clients, which they sponsored at discounted rates. And we have existing fare free for seniors and students and for youth. And again, Medicare half fare is a federal requirement, so anyone with a Medicare card rides half fare today or pre-COVID and would under any new arrangement. So just some things to think about. Pre-COVID, Go Raleigh eliminated or abated, again, 40% of its customers' fares. Our current cost to collect fares, or pre-COVID level, was about $350,000 annually. And our contracted revenue via Go Pass and other contractual revenue arrangements are not possible with a free fare. So regardless of who pays for it, if you don't have a fare, we can't charge back anyone, even if someone is willing and able to provide that subsidy. We can't charge them if we have a zero fare. So our Go Pass programs and our partnerships with Wake Transit and potential partnerships with other federal agencies do become more challenging. New technologies provide unprecedented flexibility and convenience, but do come with increased fees. And again, those are things that we see on a per swipe fee. One thing that we're looking at going to just for pure convenience, certainly for travelers that may be from out of town, is what we call the EMV or Europay MasterCard Visa transaction. That's any type of MasterCard Visa transaction. And you would just tap and go. So if you've never been here before, you don't know what the fare is, I just want to ride to a destination, you don't have to do any research except maybe know what your base fare is, and that's all, and just take your credit card and hit it, and you're done. You don't have to buy a pass in advance or use your mobile phone or anything else. So it's just another option. We think as we move forward, if we do return to fares, providing as many options as possible is going to be important to drive ridership at all levels. Another continuing issues and considerations, Wake Transit, the model for Wake Transit will or has seen reductions in our ability to cover our operating and capital as we look out into out years, taking away all the revenue from the agencies within Wake County that provide services. In November 22, the Raleigh Transit Authority did vote 6-2 in favor of reinstating fares. They were obviously, bus drivers during that time period had concerns. And then we did inform the Transit Authority of our physical challenges in FY25 and beyond last year. And I think we actually started discussions in 22. So what are the potential positive and negative outcomes of fare-free service? We did talk about these last year. I'm not going to go into great detail. They're pretty obvious, but certainly positives are improved trip generation, potential to decrease in delays because people don't have to think about using a pass, and increased accessibility or equity. Negative, general fund impact. We just saw that. Misalignment with regional partners. We know that Go Triangle is returning to fares, or maybe you don't, but they are returning to fares. We'll talk about that in a moment, but they are projected to start their fare collections July 1. And impacts, again, on the Wake Transit plan on the negative side. So what do our peers look like when we think about fares across different agencies of sizes and scope? When we think really local, go Raleigh, go Durham, we do have some of the lowest fares in the southeast. Greensboro is at $1.50, go Raleigh's at $1.25, and go Durham's at $1. And go Durham currently does not charge a fare, and it's my understanding, I do not know this for sure, but it's my understanding that they are looking to stay fare-free in FY25. Go Triangle is returning to fares on July 1, and they have just revamped their fare. They used to have a express fare, regional express fare, and a local fare. They've kind of combined that and raised their local fare but reduced their express fare. So they do have a consolidated fare now, but they sit at about $2.25. So adjust fares to improve cost recovery. So if we wanted to look at that 25-cent increase on the base fare, this is what that would look like against our existing fare structure. A single ride at $1.25 would go to $1.50, which would put us in the same realm as Greensboro and a little less than, I think, Wilmington. A day pass would be $3. And then again, when you look at the 7 and 31 day pass, they go up at a 20% rate, just like everything else. So all of these, again, would fall under fare capping. So again, if you paid that incrementally or whether you paid that monthly pass all at once, you would be eligible through that fare capping process. That would affect the ADA access as well, down at the bottom right-hand corner at $3. But we are proposing that ADA access also be eligible for the low-income fare program if we do move into fares as a mitigating factor. Base fare considerations, these are just some general knowledge points here, that it is very hard to predict fares when you hadn't had a fare in 4 years about recovery. So if any fare increase above pre-COVID levels will be difficult to project. We normally have like fare elasticity models that we can look at. If we raise a fare by a certain percentage, we know that it will impact the recovery of fare by this much. We haven't had fares for 4 years, so those models really don't work. So it is challenging. Very modest increase in Fare One revenue in year one. Contractual opportunities with base fare remain best opportunity for revenue growth. Again, looking for those others other than the source user to potentially pay that fare. And then a 20% increase in fare may result in approximately 180,000 in year one. So our overall projection for revenues for FY25 is about 50% of pre-COVID levels. And that's for a number of reasons. Number one, we know that it's going to take time to get that program fully ramped up and get people educated and understand what the fare is. And we'll talk about that, but we know that we're not going to go in straight out of the gate and collect revenue July 1. That's not going to happen. We're going to have a fare July 1, and we're going to make sure that we have plenty of time to educate and make sure that people have resources to get the passes and the opportunities they need to use transit. My apologies, one more time. We're wrapping up right here, so we're really close. I can make it with this one more break. I can feel it fading. So timing, consideration for resumption of fare collection, staff training, equipment readiness takes time. We've been getting ready since January 1. It's not a lot of expense to that. It's just making basic plans, whether that's fare collection or fare box maintenance or things of that nature, just things that we need to do that if someone says you need to be ready by July 1, that we're ready to go. Development of targeted pass and fare strategies will continue and are underway. Again, the July 1 start date is certainly feasible. But if we did have an idea of what we were doing, we'd love to work with Go Triangle as they go and advertise and think about and communicate to their riders what their new rate will be, as well as what are the options for obtaining fares or obtaining free fares. And again, going back, July 1 soft start with at least 60 days of education and outreach. And so again, that's why it's impacting our overall projection for budget in FY25. So I'm not going to read all of those bullets, but certainly communications will be an important element as we move forward with any fare return to fare. The most important, quite honestly, is just going out to our transit centers and really community engagement events and seeing and meeting with people where they are. So we would be doing a lot of that as we ramp up and go towards that fare collection. And you can see the other communication efforts that we would certainly release. We do a lot of those for our Wake Transit plan and some of our even our own service changes. So we'd certainly replicate that for sure. And again, ending with the slide that we started with, we started thinking about fares. What are the options? Again, remaining fare-free, implementing pre-COVID fare structure with those enhancements that are in the bullets below. And then finally would be a third option, which would be to increase the base fare by 0.25 or 25 cent, which would take us up closer to our peers within the Southeast. But understanding that certainly that fare-free, low-income fare-free program and other opportunities would need to be relayed to our passengers, and it would take time to make sure that everyone was educated on that. And so now for discussion. Thank you.
Okay, Councilmember Fort.
Thank you. You indicated that, well, in the presentation, it appears that one consistency would be keeping fares for teens 18, up to 18 free. I guess with your communication strategy, may I suggest you do something pretty aggressive with the Wake County Public Schools? A lot of these buses, especially with the high schools, they have stops that are, if they're not right in front of the schools, they're very close in proximity. And given the issues that they had with school bus drivers last year, it may be, if you put a pretty solid communication plan together, that may be an alternate source of transportation for high school students. And so that would be one that I would sort of plug that you add into your communication strategy. And then I saw you had some organizations with the COC. I didn't see the Salvation Army, but I know that they've got a bus stop right in front of their location as well. So that may be another organization that you'd want to reach out to.
All right, thank you.
Good suggestions, thank you. Councilmember Melton.
Thanks for all the information. You know, I've been pretty vocal in support of fare free transit, and I think that the reasons why I support fare free transit is it reduces barriers to ridership. You know, before we went fare free, you had to have $1.25 exact change in your pocket to ride the bus, or you had to have a prepaid fare card, which you could only get at like Go Raleigh or Harris Teeter. And so I think that made it really difficult for folks without a lot of advanced planning to say, I want to ride the bus today. And removing fares helped with removing those barriers. And then the other part was the equity and easing the burden on our cost burden users. And so I think if we move back to a fare structure system, the options you've presented with the mobile boarding and the credit card boarding, that will address the access issue, where now if you want to ride the bus, you can tap your phone, you can tap your credit card. I've used a similar system in Paris and London and places. I think New York's starting to implement it now, which really helps speed things up and reduce that barrier. And then if we have the appropriate programs in place to continue the fare free or fare capping for the folks who need the relief or the assistance, then I think that addresses the equity and cost issue. And so what I'm seeing now is the goals of fare free transit and the benefits of fare free transit, I think we can accomplish through these additional programs that are being suggested. And one unintended negative consequence that I've heard about with the fare free program has been some safety issues and lack of structure in the system. And I know that our transit operators have expressed concerns and some of our users have expressed concerns. And if the buses aren't safe, then no one is going to choose to ride the bus, and the folks who have to use the bus are not going to have a safe or enjoyable experience either. So I think if we can put some safety and structure back into the transit system and the fare system while still accomplishing our goals of making it very easy to ride for folks who choose to ride and providing equity and cost relief to those who are cost burdened, then I would be in support of bringing these fares back, assuming we can get those programs implemented.
Councilmember Black?
Yes, and to Mayor Pro Tem Melton's point, big proponent of, fare free, and, that's become a conversation that has been hard to keep up over the last year. You kind of let us know a year ago that this would be where we would be at now. And so, a lot of it is about the equity concerns. Like, I think it's really interesting that, we had over 50% of the riders rode before, and we've actually had an increase of ridership since we've implemented some of these programs. And a lot of people said they would stay on the bus, so that's good too. So I guess my question really centers around understanding, as we're looking at equity with fares, like the benchmarks that go into it, and how we are reflective of when like the inequities that could arise, or like things that could happen over time, and how we were reflected to that, and if we have like ways to benchmark that and be reactive to those things as they come up over time.
So it's kind of a complex question there, but thinking about our surveys annually, we get some demographic information, and we also get passenger attitudinal survey information. So we use that. We also, today's mapping tools are just amazing. We use a mapping tool for transit that gives us all of our census and even updated data right at our fingertips. So that as we build our routes, we know what our ridership will be generally before we deploy the route, at least in ranges. So using all of that data, I would just say that we need to be very diligent about our continued planning and provision of services and routes, to meet our passengers' needs, which are ever changing. The city's changing tremendously, and I can't imagine us not changing along with that. So, yeah. That may have been a very vague question as well, or answer. My apologies on my part, but
It's okay.
Just trying to make sure.
One of the things that stuck out for me when I was listening to the presentation, and I wanted to ask the question because I wanted to gauge like what the city is already doing or your understanding of it. But one of the things that stuck out to me was with the COCs. We have all these organizations that are coming in, and they're trying to do like have equity concerns and conversations. So maybe having like regular benchmarks with them to kind of understand like concerns that are coming up, since they're directly working with people who are experiencing different things in our community, and working with the city to try to create more equity when we're looking at fares and transit. So I know that the study group model has been effective in other things that the city is kind of taking an initiative in. So maybe that could be something that you guys utilize for like benchmarking and just like being reflective and reactive to some of the things that may come up over time.
And certainly working with those continuum of care members, maybe it's an anonymous survey that we can get some basic information for those individuals that would like to share, and thinking about that holistically across all the participating agencies. So,
Yeah, that's a good idea. But that's one of the things that popped out to me.
Thank you.
No problem.
Thank you. Councilmember Jones?
Thank you. I just had a thought, and I just wanted to throw it by you to see what you think. How do we activate the community to also be partners? Because I know we have this large deficit that we have to come up with, and we have ideas for that. But is there a way, looking for sponsors for rides, to include that when I ride on the bus, to say, would you like to sponsor another ride for $1.25? I tend to think about a place at the table, and when I go there and they're like, hey, if you want to donate to feed someone else, they get a lot of response from that. People want to participate in that in-depth problem solving and that solution finding. So is there an avenue of including that in what we do, so that there's a funding that could help and sponsor other rides in the future that's coming directly from the community?
Just tying that back to some other transit agencies that have done things around operations or even on the capital side, I would just say that, yes, that can be done. Many times I think that does involve a sponsoring nonprofit that manages that receipt and then distribution, if that makes sense, much like the continuum of care. But I have seen other places that do that.
Awesome. Thank you so much.
Councilmember Harrison?
Yeah, I just want to uplift that idea. I think that would be really cool. Thank you, Councilmember Jones. I was just at Place of the Table this morning, and yeah, paid it forward, doubled my contribution for coffee, and that's a way that we can all be part of these solutions. So any way that we can be more innovative there, it would be great. I also was curious, you mentioned that there would be some additional costs to these variety of platforms, to be able to, use your phone or use a credit card or whatnot. Do you have a sense of those costs, or have you been able to get any fees like that other cities are seeing from those, current systems?
I mean, we've done they all kind of vary, quite honestly, from a Visa, MasterCard type of transaction fee, which we would pay when we would not put that on the customer because they have a flat fee. But I would just say that varies greatly. But the change in the market is that software companies and hardware companies historically have always taken cost up front annually to maintain the software current. Now they've done away with a lot of those cost, so there's in some cases there's no capital fee and there's no software fee. It's just a per transaction fee. So every time somebody does it, there's a cost, and that cost goes down the more times that someone taps it. Whether that's a smart card or whether that's a Visa or MasterCard. Visa and MasterCard is pretty flat, but the other technologies such as smart cards or mobile phones are really transaction based. More transactions, the cheaper it is. And so you're in a tiered structure. And so the challenging thing from someone or from a transit perspective is that most of our dollars come from Federal Transit Administration in the form of capital, which is hardware. And these are operating expenses, which operating dollars have always, since I've been in transit, have been, the hardest dollars to find, is to put the service on the street, which is what transit's all about to start with.
I guess it'd be helpful if just to see some budgeting on that, to understand what are expected costs. I mean, what percentage are we going to lose in our revenue? I think about all these, streaming platforms that we have, and then the cost goes up and up and up, and they take away the features. And I just want to make sure we're not in some kind of, situation like that.
Understood.
Mm-hmm. Councilmember Patton?
Yeah, hi. So I have, since January, when we talked about this last time, been pretty itchy about reinstating fares. I'm continue to not be crazy about it. But I know this is a time for us to give you feedback, and I know that we're facing a very real, practical budget deficit that needs to be met in a variety of ways. As far as feedback, hearing that you're not exactly sure how much revenue will come back when we reinstate fares, because we haven't, had anything to benchmark it with for 4 years. I would not be in favor of doing the fare increase that is one of the options listed. I would prefer to leave it as is and then reinstate so that there's sort of as little change. At least our Lifeline riders who were riding before and will continue to ride with us are having at least a little bit of consistency. So that's kind of where I land individually on that part. I would be in favor of us keeping the fare rate the same. One question that I had, you mentioned the Medicare 50% rider. It kind of pinged for me Medicaid and Medicaid expansion that we just experienced in North Carolina. And I know that some places are using their Medicaid dollars in unique ways for housing with this idea that housing is health. I think there could also be a case made that transportation is health and transportation gets people to health care. And I was curious if there's been any exploration or if you're aware of any cities who have found creative ways to use Medicaid dollars toward transportation.
The short answer is yes.
Okay.
There are certainly ways to capture that. Maybe not in the traditional thought process of like a fixed route bus pass necessarily, although that might not be out of the question. But certainly on the paratransit world, depending on the type of trip, Medicaid does classify types of trips as Medicaid eligible. And so transit agencies that can capture that type of information do charge back Medicaid directly or through a partnership with a county or some other entity that is authorized to bill Medicaid.
Okay, cool. That's awesome. And my only last comment would just be that as you all continue to explore how we might roll out these modernization elements, please test them closely, pull in IT, be close partners with our friends at the Mayor's Committee for Persons with Disabilities so that we don't, you know what I'm hinting at.
Very, very much understood. Thank you.
Based on Councilmember Patton's remarks, one thing I'd like to see is if we don't include a 25% fare increase, what is that impact on the budget? I guess that can come to us at a later date. Okay, thank you.
Thank you.
Any other comments? Have you gotten the feedback you need? David?
Yes, I do appreciate it, and we'll be happy to provide any more detailed information. I heard a couple of things up here that we might need to follow up on, so we'll certainly do that. Thank you.
Okay, thank you very much. Okay, I am going to adjourn the work session then, and we will be back here at 1 o'clock. Thank you.